As you would expect for such a relatively young profession with diverse application, there is a lot of different definitions of horticultural therapy. They include strict portrayals of horticultural therapy in healthcare terminology, and also those that broadly include any beneficial horticultural experience. Recently, it's been defined more narrowly. They use alternative terminology for the positive effects of gardening and also passive garden exposure on the general population. In 2007, the American Horticultural Therapy Association described 4 types of horticultural therapy programs, and they include horticultural therapy, which is the use of plants by a trained professional as a medium through which certain clinically defined goals may be met. Therapeutic horticulture is the process by which individuals may develop well-being using plants and horticulture, and this is achieved by active or passive involvement. Social horticulture is the participation by a range of vulnerable people in groups and communities whose activities are centered around horticulture and gardening. It is distinct from domestic gardening because it operates in an organized and formalized environment. Vocational horticulture. This is dependent on the required outcomes identified by the client. It may be appropriate for them to work towards employability goals or to develop work skills and potentially use their involvement in the project to gain work experience to move on to a voluntary or paid position in the future. Some horticulture therapists now refer to their programs as therapeutic horticulture, particularly those that include active or passive involvement with plant-related activities that do not focus on the clinically defined treatment goals. Thrive, an organization in UK, for example, uses the term social and therapeutic horticulture to describe a full range of program types and purposes for health and well-being. The following definition is also presented to describe horticultural therapy in its many forms. This definition includes 3 elements as described by Dorn and Ralph in 1995. The client served, the therapy goals, and the treatment activities. So they describe horticultural therapy as a practice that serves defined client groups, so those with identified therapeutic or rehabilitation needs, that is goal-driven, so based on standard treatment procedures, and that uses the cultivation of plants as its primary treatment activities. These authors state the importance of the presence of all 3 elements to distinguish horticultural therapy from other types of garden interactions. So the graphic model of horticultural therapy from Matson in 1982 depicts the various interactions of a client, horticultural therapist, and the plant during a horticultural therapy session. A key element in this model, the trained horticultural therapist, has the skills to use plants to facilitate the therapeutic process. An adaptation of these earlier models shows the client as the central figure within the process of horticultural therapy interaction. The client is both receiver and initiator of the treatment process. In this model, there are 4 elements, including client, goals, therapist, and the plant. The client is the person being served, so usually someone with an identified need for intervention to either improve their cognitive, emotional, physical, or social functioning. Goals are those treatment goals and objectives defined by the client and the treatment team. The therapist is the professional who is trained in the use of horticulture as a medium for therapy, for rehabilitation, for wellness, so the horticultural therapist. And lastly, the term plant is used here to signify those garden and plant-related activities and tasks that we use to provide therapeutic opportunities to the client. So there is a connection between all of the 4 elements. The therapist interacts with the client through the plant or by direct contact. The plant activities are chosen to meet the goals of the client. The client interacts with all other elements, and it is in the center of the program to illustrate a focus on the participant in the horticultural treatment process. The important thing to remember here is that horticultural therapy is based on purposeful horticultural activity or work, so the cultivation of plants. A passive enjoyment of gardens and plants may be included as part of the program too. Similarly, the guidance, judgment, and creativity of trained therapists and stated treatment objectives are essential elements in horticultural therapy programming in order to maximize the benefits derived from the people-plant interaction. So these definitions should help practitioners to know when and if their work should actually be defined as horticultural therapy, because programs that offer gardening activities without goals and treatment procedures, while they are beneficial, are not generally considered as horticultural therapy. The therapist is responsible for planning treatment, developing sessions, interacting with the client, and recording outcomes or results. For example, if you take a community garden coordinator who runs a program for youth at risk, he or she would benefit from writing clear objectives and documenting outcomes. Although these and other community horticultural programs may not be within a strict definition of horticultural therapy, what they have in common is the focus on human benefits rather than the plant cultivation or physiology.